I am Dr. Sujit Kumar, Senior Consultant Neurologist and Epileptologist at Apollo Hospital, Sheshadripuram. Today I would like to speak a few words about epilepsy. Epilepsy is a disorder characterized by recurrent seizures due to a chronic underlying condition. Now, what is a seizure? A seizure is an event which occurs in the brain due to a hypersynchronous firing of neurons, resulting in various manifestations such as motor, sensory, autonomic, and experiential. So, this is what constitutes epilepsy and seizure. Now, seizures can be of various types. You can have focal seizures or generalized seizures. Focal seizures are seizures which start from one part of the brain and do not spread to the other parts of the brain. You can have two types, those with which are pure focal and those which are complex partial, where there is impairment of consciousness or behavioral arrest as well. And then we have generalized seizures where the seizure involves both hemispheres. So there are different types of generalized seizures such as generalized tonic-clonic seizures, myoclonic, absence, atonic, and other types. Sometimes a seizure can start from one part of the brain. That means it can start as a focal seizure and then it can spread over the brain, becoming a secondary generalized seizure. So epilepsy has been a problem which has been both medical and social since time immemorial. In ancient India, it used to be considered that the people who suffered from epilepsy were possessed by evil spirits and they would proceed to ill-treat them till it is considered a taboo in Indian society even now, to the extent that if people who are with epilepsy get married, they very often get persecuted by their partner. So these things are prevalent. The only way of getting rid of all of this is by increasing the education about epilepsy. So a few myths and facts about epilepsy we can discuss in sequence here, so that we can help. This will help us to understand the perceptions about epilepsy. Firstly, there is a myth that a person with epilepsy cannot lead a normal life. This is not true. 70% of people with epilepsy can achieve complete seizure freedom with medications, and they can live a complete normal life. They can live, they can have a family, they can do their work very well, and they can have a productive life. Another thing is, people with epilepsy cannot marry. This is also completely wrong. People with epilepsy can not only marry, they can raise normal families also. Some medicines are contraindicated during pregnancy, and this period should always be followed up with a good neurologist. There are several other myths and facts about epilepsy, such as when a person has an epileptic seizure, something should be given in the hand or mouth. This is totally to be condemned, as what should be done when a person with epilepsy has a seizure, they should be turned to one side. All sharp objects and other things which can hurt them should be moved out of their range, and one must not try to restrain these people when they have these clonic movements, as that can cause severe injury. One must also not give anything by mouth until the person with epilepsy who is having a seizure becomes completely conscious. So these are some myths and facts about epilepsy. There are some precautions also a person with epilepsy has to follow. They must take their medications regularly and not miss them. They must avoid driving as well as sleep deprivation. Alcohol should also be avoided, as it lowers seizure threshold. Certain drugs can also lower seizure threshold, so it's very important for a person with epilepsy seeking medical assistance for other ailments to tell their physician or doctor whom they're consulting that they're on these medications. So these are some important precautions. How is epilepsy diagnosed? Epilepsy is diagnosed by a good medical history and clinical examination. After this, the patient or a person with epilepsy is advised by the doctor to undergo certain tests. Commonly done tests are MRI brain or CT brain, electroencephalogram, and certain blood tests. Majority of the people can be diagnosed based on these investigations, and with appropriate trial of anti-epileptic drugs and counseling can achieve complete seizure freedom. About 70 to 80% of people will have complete seizure freedom with these medications and can lead a normal life. About 30% of people who do not achieve seizure freedom with medication, they fall under a category called medically refractory epilepsy. Usually it's like a rule of two, wherein if they don't have seizure freedom with two drugs for a seizure-free period of at least 1.5 years, then one should consider them as having medically refractory epilepsy. Certain other investigations are done by the epileptologist and the epilepsy surgery team in this situation, such as video EEG, detailed MRI, functional imaging such as PET, SPECT and fMRI brain. All these things are used to find out which part of the brain is firing, and with an appropriate surgery called epilepsy surgery, the person can undergo this surgery and this can render them seizure free in as high as 50 to 70% of people undergoing this pre-surgical evaluation. In a very small subset of patients wherein it is not possible to identify with MRI and functional studies, one may have to go for an invasive EEG where stereotactic EEG or subdural grids and strips are used, and an invasive EEG recording is done to try and localize the area from which epilepsy is coming. So let us spread this awareness about epilepsy, let us dispel the myths about epilepsy and bring out the people with epilepsy from the shadows so that they can lead a normal, productive and comfortable life. Thank you.